Welcome to today's compliance tip regarding the auditing of diagnostic lab test orders according to CMS guidelines and the simplifying documentation requirements. This is provided by the American Institute of Healthcare Compliance. The Centers for Medicare and Medicaid Services, or CMS, has implemented change to reduce redundancy to decrease documentation time so providers can focus more on patient care. In December of 2018, CMS revised instructions according to the Patients Over Paperwork initiative. Healthcare organizations should be using these guidelines when conducting internal audits to ensure orders meet the minimum standards set forth under Medicare law. Now, healthcare organizations should be using these guidelines and helping to identify potential problems and making internal corrections. All healthcare providers should be conducting a baseline audit and periodic internal audits according to the Office of the Inspector General, or OIG, recommendations. These recommendations are found in the compliance guidances published by the OIG and can be located at www.oig.hhs.gov. By following the OIG and CMS guidelines, your organization is more likely to pass an external payer audit in this area. The revisions apply to CMS's medical review contractors, such as Medicare Administrative Contractors, Recovery Audit Contractors, the RACs, the Unified Program Integrity Contractors, and Supplemental Medical Review Contractors, reviewing Part A and Part B claims nationwide. CMS's instructions to the contractors are contained in what's called the Program Integrity Manual, and that can be gotten from cms.gov under the Rules and Regulations Internet Manuals. And it's specifically publication 100-08, Chapter 6, and 6.9.1. Now, all diagnostic tests need to be ordered by the treating physician or provider and must be medically necessary. Medical necessity is outlined in the Laboratory National Coverage Determinations, or NCDs, and Local Coverage Determinations. So please take a moment to view our medical necessity playlist that covers such information. Order requirements will likely be approved when these areas of documentation are met. It's obvious not having a signed order or a requisition is going to cause a problem. So it is best, whenever you can, to have signed orders. However, having unsigned orders or unsigned lab requisitions are compliant when accompanied by a properly authenticated progress note in the medical record indicating the intent to order. And the Medicare Benefit Policy Manual, which is publication 100-02, Chapter 15, Section 80.6.1, it states that while a physician order is not required to be signed, the physician must clearly document in the medical record his or her intent that the test be performed. Regardless of how the order requirements are met, CMS contractors are instructed to verify that the supporting authenticated medical record documentation contains sufficient information supporting the ordered and provided tests and that they are reasonable and necessary. Consider enrolling in the Comprehensive Clinical Documentation Improvement course and becoming a Certified Medical Documentational Professional, or a CMDP, through our organization, the American Institute of Healthcare Compliance. Call us toll-free at 866-571-5635 or go to our website, aihc-assn.org. I hope you enjoyed today's presentation.